Hey there. Have you ever noticed a stubborn itch that just will not quit? You might think it is just dry skin or a minor irritation, especially if you are over 60. But what if your body is trying to tell you something serious? For older adults, certain itchy spots can be an early red flag for cancer, sometimes signaling trouble long before other symptoms show up. In this video, we are diving into 5 specific areas where persistent itching could point to something more than a simple skin issue. Stick with us to learn what these spots are, why they matter, and how to spot the difference between a harmless itch and a warning sign you cannot ignore. Sign 1. Persistent itching in the anal or genital area. If you are over 60 and dealing with a constant itch in the anal or genital region, you might brush it off as poor hygiene, irritation, or a minor skin issue. But when there is no infection, no rash, and no clear cause, this itch could be your body raising a serious red flag. This kind of relentless itching, especially when it feels raw, burning, or deep and does not stop with creams or better hygiene, has been linked to anal, vulvar, or penile cancers in older adults. It often hides as something small, making it easy to ignore. Here is why it matters. These cancers can irritate nerve endings in these sensitive areas, causing an itch that feels different from surface-level discomfort. It might linger for weeks, worsen at night, or stay in one spot. Picture this. A 74-year-old man named Harold thought he had irritation from sitting too long. He tried creams, changed soaps, and used softer toilet paper, but the anal itch kept coming back, sometimes feeling like a burn. After months, he saw a specialist. A scope exam found a small lesion in the anal canal, an early-stage tumor caught just in time. That itch was his body's only early clue. For women, vulvar cancer, though rare, gets more common after 60. It might start as an itch on the outer genital area, with skin feeling rough, slightly discolored, or thin. Many assume it denotes it is menopausal dryness, but if it does not respond to treatments and keeps nagging, it needs attention. This area is packed with nerves, so it often signals changes before visible signs appear. If the itch is focused, persistent, and paired with a raw sensation or slight swelling, it could point to something deeper, like lymph node issues or early cancer. For older adults, talking about this can feel awkward. It is tempting to stay quiet, fearing embarrassment, or thinking it is no big deal. But ignoring it is riskier. If you or someone you care about has been battling an anal or genital itch for weeks, trying every remedy with no relief, do not wait. Tell your doctor, describe the pattern, and ask for a thorough exam, maybe a scope or biopsy. It might feel uncomfortable to bring up, but catching something early can change everything. Your body cannot speak, but it can signal, and this is one sign you do not want to miss. If this area keeps itching with no explanation, take it seriously. It could be your body's way of asking for help before things get worse. Sign 2. Itching between the shoulder blades or upper back. If you are over 60 and feel a persistent itch right between your shoulder blades or across your upper back, you might brush it off as dry skin, a tight shirt, or maybe just the weather. But when there is no rash, no irritation you can see, and no reason for it to keep nagging, this itch could be your body hinting at something serious. This kind of deep, stubborn itching, especially when it feels like it is coming from under the skin and does not quit even with lotions, has been linked to pancreatic cancer in older adults. It can show up months before pain or other signs do. Here is how it happens. Pancreatic tumors can grow and press on the bile ducts, which carry bile from the liver to the intestines. When these ducts get blocked, bile salts build up in your blood. Those salts irritate nerve endings, often in the upper back where sensory nerves are dense, causing an itch that feels internal and relentless. Imagine this. A 68-year-old woman named Diane woke up night after night, scratching her upper back. She tried new soaps, switched mattresses, and even used a back scratcher. But the itch stayed. It was not on the surface. It felt deeper, like something she could not reach. Her doctor first suggested dry skin, but when Diane mentioned feeling tired for no reason, blood tests showed high liver enzymes. Scans found a small pancreatic tumor pressing on her bile duct. That itch was her body's only early warning, long before pain or digestive issues appeared. Stories like this are not uncommon. The key is in the pattern. If the itch is focused between the shoulder blades, lasts for weeks, and does not respond to creams, especially if you notice darker urine, pale stools, or unusual fatigue, it might point to something internal. For older adults, these subtle signs are easy to ignore. We might not want to make a fuss over an itch, but your body knows more than you think. If it keeps sending the same signal, it is worth a closer look. If you or someone you love has been dealing with this kind of itch, night after night, with no relief from lotions or changes in routine, do not dismiss it. Talk to your doctor, mention the pattern, and ask about tests like blood work or imaging. It might feel like a small thing to bring up, but sometimes the quietest clues are the most important. Your skin cannot talk, but it can signal, and this is one sign you do not want to miss. If your upper back keeps itching with no clear cause, take it seriously. It could be your body's way of asking for help before the problem grows bigger. Let's connect. Drop a comment below with your thoughts or any questions you have. And if you found this helpful, hit that subscribe button and tap the bell so you never miss a video. Your support keeps us going. Sign 3. Itchy scalp without visible flakes or dandruff. If you are over 60 and your scalp keeps itching with no end in sight, you might think it is just dry air, a new shampoo, or aging skin kicking in. But when there is no dandruff, no redness, and no obvious cause, this itch could be your body raising a quiet alarm. This kind of persistent itching, especially when it feels like a tingling or burning sensation that moves around and ignores anti-dandruff shampoos or oils, has been linked to blood cancers like leukemia or even scalp skin cancers in older adults. Here is why. When leukemia cells multiply in the blood, they can trigger abnormal immune responses, causing nerve irritation that shows up as a nagging scalp itch. It is not your typical dry scalp. It feels deeper, more restless, and no product seems to calm it. Picture this. A 73-year-old man named Carl noticed his scalp itching every evening. He switched shampoos, ditched his favorite hat, and even tried moisturizing oils, thinking it was a sensitivity issue. The itch stayed, sometimes crawling from one spot to another. When he got blood work for unrelated tiredness, his doctor found high white blood cell counts. A bone marrow test confirmed early-stage leukemia. That scalp itch was his body's first hint, showing up before other symptoms. This is not rare. For older adults, scalp itching can blend in with normal skin changes, making it easy to ignore. But what makes this itch different is its stubbornness. No cream soothes it, no treatment helps, and it feels disconnected from surface issues. Skin cancers on the scalp, especially where hair thins, can also start as a small itchy patch that looks like nothing but keeps bothering you. If the itch lasts weeks, especially with fatigue, easy bruising, or feeling off, it is time to act. Scalps are hard to check alone, so ask a partner, caregiver, or hairdresser to look for odd patches. If you have been battling a scalp itch that will not quit, despite trying everything, do not brush it off. Talk to your doctor. Ask about blood tests or a dermatologist visit to examine the area. It might seem like a small bother, but sometimes the tiniest signs tell the biggest stories. Your scalp cannot speak, but it can signal, and this is one clue you do not want to miss. If your scalp keeps itching with no explanation, take it seriously. It could be your body's way of asking for help before things get more serious. Sign 4. Localized itching on the chest or breast area. If you are over 60 and notice a persistent itch on your chest or breast, especially around the nipple or under the breast, you might think it is just sweat, a tight shirt, or aging skin thinning out. But when the itch stays in one spot, with no rash or obvious cause, it could be your body sending a serious signal. This kind of focused, stubborn itching, particularly when it feels warm, tight, or rough, and does not ease with creams, has been tied to inflammatory breast cancer or tumors near the chest wall in older adults, both women and men. It can show up before any lump appears. Here is how it works. These cancers can cause skin changes or press on nearby tissues, irritating nerves and creating an itch that feels deep and relentless. Imagine this. A 67-year-old woman named Marie felt an odd itch on her left breast for months. She switched bras, tried gentler soaps, and even stopped wearing underwire, thinking it was friction. The itch stayed, always in the same spot, sometimes with a slight redness. Her doctor noticed faint skin dimpling during a checkup and ordered tests. Scans found a small, aggressive tumor near the skin's surface, with no typical lump. That itch was her body's first clue, said she was catching it early. This is common with inflammatory breast cancer, which might mimic a rash or irritation, but spreads fast, often starting with just an itch. For men, though rare, breast cancer can also begin as an itchy patch near the nipple or a thickened spot on the chest, easily missed because it does not seem serious. The itch might also stem from swollen lymph nodes under the arm or near the collarbone, hinting at lymphoma or other cancers. If the itch lingers for weeks, feels deeper than the surface, and comes with swelling, warmth, or a heavy sensation, do not ignore it. For older adults, these subtle signs can be easy to dismiss as no big deal, but your body is smarter than that. If you or someone you care about has been dealing with a chest or breast itch that will not quit, despite trying lotions or clothing changes, speak up. Tell your doctor, describe the pattern, and ask about imaging or exams. It might feel like a small complaint, but sometimes the quietest signals are the loudest warnings. Your skin cannot talk, but it can alert you. And this is one sign you do not want to overlook. If your chest or breast keeps itching in one spot with no clear reason, take it seriously. It could be your body's way of asking for help before things get worse. Sign 5. Persistent itching on the lower legs. If you are over 60, a constant itch on your shins or calves that will not go away might feel like a minor nuisance. You might think it is just aging skin, a new soap, or dry air causing trouble. But when there is no rash, no flaking, and no clear reason, this itch could be your body sending a quiet warning about something serious. This relentless itching, especially if it worsens at night or ignores every cream you try, has been tied to blood cancers like lymphoma in older. Here is why. These cancers grow in the lymphatic system, your body's network for fighting infections and clearing waste. As cancer cells spread, they release chemicals that irritate nerves, causing a deep, nagging itch in the lower legs. It is not a surface issue. It feels like it comes from within, and no lotion seems to help. Picture this. A 71-year-old woman named Ellen noticed her calves itching for months. She tried every moisturizer, switched detergents, and even changed her socks, thinking it was an allergy. Nothing worked. The itch kept nagging, worse at night, disrupting her sleep. Her doctor first thought it was a skin irritation, maybe eczema. But when blood tests showed odd white blood cell counts, scans revealed swollen lymph nodes. The diagnosis was lymphoma, And that itch was the first clue, appearing before other symptoms. This happens more often than you might expect. The difference lies in the details. If the itch lasts weeks with no cause, no rash, no bug bites, and no relief from remedies, it is time to take notice. This is especially true if you also have night sweats, fatigue, or unexplained weight loss. For older adults, these signals can be subtle because our bodies do not always sound loud alarms. Pain might be absent, and lumps might hide deep, but nerves can still react, and an itch is often their first voice. If you or someone you care about has been scratching their lower legs night after night, trying every cream with no success, and wondering why it persists, do not ignore it. Talk to your doctor. Ask for blood tests and explain the pattern clearly. It might seem like a small thing, but sometimes the quietest signs carry the biggest warnings. Listening closely could catch something early when it is easier to treat. If your lower legs keep itching with no explanation, take it seriously. It could be your body's way of asking for help before things get worse. Your body is always speaking, sometimes through a nagging itch or a subtle hint. Those tiny clues can point to something serious. The 5 spots we discussed today are not random. They are where issues like cancer often send their first signals. For older adults, tuning in can change everything. If something feels off, do not wait, talk to your doctor. Drop your thoughts in the comments, hit that subscribe button, and tap the bell. Thank you for joining us, and we will catch you in the next video.